Oh, we are live.
See that? That's the lady with the glasses that everybody can see. Says that we are on. And as always, I say welcome to Pop One's Health and Community Tips for the Week. The purpose of this program is always, the Bible says, my people perish for lack of knowledge, is to bring you all the health information so that you can learn to choose a healthy lifestyle or, if necessary, make informed healthcare decisions. And community tips, just good information for you to have. And it is our pleasure to come on every Monday morning to give you good information. And we're excited because we have Miss Dorcas Woody back that's going to be talking about Georgia Strong Families and how she was talking about getting those dads involved in the children's lives and talking about preconception and all that good information that someone my age with my earlier children I didn't have. But then they started opening things up and start realizing how important bonding is, and I just love Dorcas and them for that. And then we have our special guest that Andrea Winston has been banging me over the head and making me do push-ups every week, drop down and give her 25 push-ups. You understand, like a drill sergeant, until I got Dr. Charis Chambers
That's
on.
right.
And
That's
so
right.
you see how she did it? Drop down and give me 10 more. And so we're going to kick off with Dorcas. And Dorcas, please leave off. Take a minute, let everybody know who you are, what you're at, your contact information, and then leave off with those slides where you're talking about all the good information.
Yes, sir. So hi everybody. Thank you for having me on again, Pop. I actually absolutely love being here to talk about our Georgia Strong Families program. My name is Dorcas Woody. I am the program coordinator. We are located within the Columbus Health Department, and we work with moms and babies and dads prenatally till the baby is 18 months old. I came on today to talk about our fatherhood initiative really quick. We have a new session starting, and we are recruiting dads. So um, we are just trying to get dads into our program. So really quick, the Fatherhood Initiative, like I said, we work with men. We want to empower them to be active in their child's lives. Men are very vital to the health and wellness of their children. And so we try to encourage men to be more involved. They don't have to be in a relationship with mom. And, you don't necessarily have to be a super dad to be a great dad. That is our absolute motto here. We say it daily, and we absolutely mean it. We really focus on helping men to meet their needs, making sure that they have access to resources and information that they might need, while also making sure that we emphasize on the importance of being involved with that baby. We do work with men in Muskogee County currently. It is our hopes to hopefully expand at some point, but right now we are only in Muskogee County. We have some sessions coming up that we would like to get more dads in the community involved in. It is our 24/7 dad sessions. And so these sessions meet once a week for 12 weeks. They discuss topics related to fathers. Those topics include stuff like men's health, communication, the role of a dad in with their child, co-parenting with that mom, what it means to be a man. These sessions are facilitated by our male facilitator. It is for men. It is put on by men. We women are really in the background for administrative purposes. We don't attend those sessions, but we're here to help and provide extra resources if needed. That is the men's space to be able to just freely talk about topics amongst themselves and help each other. Currently, due to COVID, we're having those sessions via Zoom. Before COVID, we were having them in person. We made sure men had a hot meal and they were able to fellowship amongst each other. It is our hopes that soon we'll be able to go back in person, of course, with some COVID guidelines in place. But our upcoming session will be via Zoom. We do provide meal cards after each attended session, just so that meal is still there. So you'll get a meal gift card to be able to use and take to whatever restaurant we have it for, to get you a little lunch or something later on. During those sessions, we have special guests come on. They talk about things like financial literacy, job readiness, health and wellness, of course. We always have Dr. Clyde from the Tree of Life come and talk about the importance of men's health. We have Columbus Tech and Columbus State come on and talk about education opportunities and scholarships that they have. So we really just want to make sure that the men are taken care of and they're able to focus on get their needs and concerns met so that they're able to care for their child.
And Dorcas, I have had a number of men in the community, well-known individuals in the community that would like to be involved in this here. I know DJ Chip Mitchell said he would like to be involved, and 100 Black
That's
Men.
right.
And would you give the number that they could call to contact to be on board with something like this here?
Yes, sir. So of course our contact information, currently myself and Ms. Sharon Moore are over facilitating the fatherhood program and so our main office number is 706-321-6322. And then you can always reach us individually within our offices. We do have a part-time fatherhood facilitator who is getting acclimated with the program. We just hired him recently to take over fatherhood. And so soon it will just be him and you, Pop. You'll invite him on and he'll tell you more about fatherhood once we get him acclimated.
And that's awesome. And also, while I have you on, the next council meeting that we have is the 11th. I would like for you to come on. You're talking about you're starting a new program. I would like to invite you on the public agenda on the 11th. It's at 9 in the morning for you to come on. And I will give you the phone number if you'd like to do that. Or I could call you later and give it to you. But I'd like for you to come on because I'd like for more men to be involved in this program, to know how important it is to be involved in their child's life.
Yes, sir. Yes, sir. And we'd love to go and present in front of the council. You've had us do it once before, and it got us, wonderful, partnerships happening, and so we would love to do it again.
All righty.
I just want to quickly say that our next 24/7 Dad session will be starting this Thursday. It's on the 6th. They are from 6 to 8 p.m. We do not turn any men away, but we do have eligibility requirements that we must meet because we are a grant-funded program. And so we do serve fathers or father figures aged 14 to 60. They must live in Muskogee County and be expecting a baby or currently parenting a child that is 0 to 18 months. And any participant who enrolls and starts attending the sessions do receive an enrollment packet. And so it comes with a $10 Walmart gift card, a pack of diapers and wipes for your little one, and then a fatherhood gym bag that we have. And that's just for enrolling. Like I said, we don't turn any men away though. So if there are men out there in the community that still want to get the information from the 24/7 Dad sessions, but don't meet this criteria, still give us a call. We'll get you hooked up with our fatherhood coordinator and make sure that you have that Zoom information so you can attend those sessions, because we don't want any man to feel like because I didn't meet these criteria, I'm not important, because you are. And we want to make sure that you have the information to be a great dad. Doesn't matter if your child is 10, doesn't matter if your child is 25. We want to make sure that you have this information.
And Dorcas, believe it or not, I've had a number of people. Let me mention this before because I did. I'm talking about individuals like myself who are the supreme elitist seniors who are 70 and above, who are great-grandfathers that are still surrogates for individuals that we recognize in the community. So when you come to council now, you be sure to let them know that we say age 60, but individuals who are of the sublime age, like Pop Barnes, the Bible says first his age is 70. That's 70. So we're a bit blessed. There are a lot of seniors, grandfathers that saw the program and said, we have time. A lot of us are retired, many retired military, and we would like to be involved because we know that there may not be enough men, but so at council, you be sure to say, we say 60, but some of you men who are above the age of 60 that would like to be involved in a program like this to share your wisdom and your experience of age, please feel free to come. Dorcas, this is a marvelous program. It is really sorely needed in this community. It brings people from where they're at. It supports the women and the men and the child. And so it's just an awesome program. I will give you the number now, but you can call me later. For
Yes, sir.
the clerk of council's number is 706-653-4013. And would you
Yes,
call
sir.
them and let them know that, yeah, Pop Barnes would like to have you on the public agenda speaking about the fatherhood program and its initiatives. And I'd just like to thank you and staff for having this program, because it's a godsend in the community, Dorcas. And thank you for all you do.
Yes, sir. Thank you so much for having me on. You know, we are available anytime that you want us to come back.
And anytime you want to come on, I'll fit you in on a regular schedule. The lady with the glasses right there, or do a pre-show like this here, because we just love what you're doing. Thank you
Yes,
so
sir.
much again, and God bless you now.
Thank you. Y'all have a wonderful day.
All
Hi,
righty.
Dorcas.
And now our viewing audience, we have, and when I'm not joking, dropping me down for push-ups and making me run an extra mile in the morning, as old as I am, to get Dr. Chambers on. And I was mad. I said, wait a minute, what do you just Dr. Chambers? What you made it? She said, you better put her on. So Dr. Chambers, I'm so glad that you did. And Dr. Chambers, you are a super trooper. You are a super trooper to have traveled and be here. Look at that. See that? Dr. Look, she's fitting right on in. She's fitting right on into entertainment now. And Dr. Chambers, to our viewing audience, please let everyone know about you and your father and your brother and your marvelous, where you are located at. Give them all that contact information. We're going to take the time for you to do that before you do your slide presentation. Absolutely. And so we have, you browbeat me, Andre. Would you do the introductions? You do the introductions to Dr. Chambers.
Yes, sir. Yes, sir. Now, Pops, you have all those people thinking that I'm beating you up. And that's, what you're talking about is actually what you do to us. You know, he starts getting stressed about this on Friday evening, calls you through the weekend to make sure that you got your stuff ready. Monday morning about 5 a.m., you start getting text messages saying, are you going to be on the call this morning? We're going to have formation at 6 o'clock. You got to run laps.
Be ready for those
I don't
push-ups.
want our audience thinking that, I'm the taskmaster here. So we want to, what, Susan, you don't have your glasses this morning?
I got my glasses.
Okay, well,
I
put
have
them on.
glasses will travel.
Pops keeps talking about him, and I keep looking. And I said, "Well, I don't see the glasses." So, this is just what we do, Dr. Chambers. We want to just welcome our guest this morning, Dr. Chambers here. She's done a lot of research and background, and her specialty is adolescent health and adolescent GYN to be exact. And that's a really highly specialized practice that she has. And for those mothers that are training up daughters that need to take care of their own health, she's a godsend. And a lot of times us older ladies, we didn't have the benefit of these conversations that she has with us and our daughters from our mothers. So it's important that we know how to form an alliance with our provider and see them as a trusted partner and taking care of our health. And she's got the personality and the compassion that makes all people feel comfortable talking about some things that you may not otherwise want to talk about. So we just welcome you, Dr. Chambers. Don't pay attention to Pop. We're good people here this morning. And want to welcome everybody in our viewing audience this Monday. I know it was storming this morning, but my word for today this morning this is our focus on. The word for the day is going to be gratitude. And I've been talking with my children about that. What are we grateful for today? Because I know a lot of times Monday morning, including me, you want to drag out the bed, it's raining, you just want to turn back over and find a cool spot and go back to sleep. But I'm glad we have all these wonderful, bright and smiling faces this morning, and we are going to go forward with gratitude. All right, Pops, is that enough?
Yes, that's it. And let me tell you something. Everything you said about Dr. Chambers, even though you browbeat me, it was worth all the lashes and the knock upside the head and all that stuff. But it was worth it to get Dr. Chambers on. And so, Dr. Chambers, please say something. Now, I know Andrea had let everybody know your brick and mortar location, how long you've been, about your father, your brother, and then when you're comfortable, go into your presentation.
Absolutely. So thank you so much for having me this morning. As previously mentioned, my name is Dr. Charis Chambers. I am a board certified OBGYN and a fellowship trained pediatric and adolescent gynecologist, which really means that I focus on girls that are younger. So 21 and under is the age group that my specialty focuses on. And I just returned to the Columbus, Georgia, Phoenix City area, really starting my practice in September of last year. But I'm from Phoenix City. So I actually went to, elementary school here. I went to Smith Station for high school. After that, I went to Spelman College in Atlanta, Georgia, which was amazing. I loved it. I then went to medical school at UAB in Birmingham, Alabama. I did OBGYN residency for 4 years in Greenville, South Carolina. And then after that, I wanted some additional training because I knew I wanted to focus on the younger population. And so I did a fellowship training program at Baylor College of Medicine in Houston, Texas for 2 years, which I finished in 2020, moved during the pandemic back home, where I partially joined my father and brother in practice. Those are the other two Dr. Chambers, Dr. Crandall Chambers and Dr. Wesley Chambers, in Chambers OBGYN. And then I have my practice for girls that are 19 and under, associated with Piedmont Hospital System at 705 17th Street, Suite 403. And so I have those two locations so that I can get the fullness of my scope, which is caring for girls that are 21 and under. As a pediatric and adolescent gynecologist, my favorite things to do are to educate and empower administrators and to kind of bridge these generational gaps where we may not have known these things when we were going through it, or a grandmother or guardian may not have been taught these things, but we can unlearn and make changes that support youth and allow them to, educate each other and to really grow and excel scholastically, athletically, emotionally, socially, all the things that can be impacted by your health. So I'll start sharing my slides. If that was an adequate introduction?
It was great.
Okay.
Hey, Andrea, she's right on. She's fitting right on in.
What you guys put down. Okay. So I'm talking with you guys today about puberty and periods, really what every person should know. And that's I chose that word person intentionally because I want to include fathers, mothers, guardians, siblings, partners, anyone. Really, we should have a much better understanding about puberty and periods than we do. And that's because for many years, this has been a very taboo topic. And it's so absurd when you think about it because it happens. It's a normal process of physiology. It happens to all of our females going throughout their kind of teen to young adult years. So it's super important. So I like to start by defining puberty. What does that even mean? So puberty is the process of changing from a child to an adult with the capability of reproducing. I like to use this image because it shows somewhere between childhood and motherhood, puberty does need to occur. Now, obviously, motherhood is a choice. That's not something that everyone has to enter into by virtue of being a female. But puberty in and of itself is not necessarily a choice. And so it's one of those things that we really need to understand and ultimately prepare for. So a lot of people say, hey, what starts this? What starts puberty? And honestly, we don't exactly know. It's not a switch that you can just turn on and off or time perfectly, but there's something at the brain level that releases a hormone in a pulsatile fashion that ultimately stimulates the ovaries. The ovaries are the key organ when it comes to reproduction and just women's health. We see a lot of external changes. That's what we're kind of really used to seeing and talking about when it comes to puberty. Oh, I know this person's going through puberty because they're getting taller. They're getting a little bit more acne. They're getting some hair on their body. They're growing some breast tissue. Maybe they have to wear deodorant because they're starting to have more body odor. Their feet are growing. All of these things actually are a part of the process of puberty. Unfortunately, we focus on some of the more sexualized characteristics like breast changes, but it's really a whole process of height changes, different hormones, and they all manifest in certain ways. Hormones, I'd like to just kind of talk about that because hormones get a bad rep. We always blame them for everything. It's my hormones, But hormones are actually critically important. Estrogen and progesterone are the two most important ones for women when it comes to the function of having puberty and period changes. But there's also testosterone. So women have certain levels of testosterone, men have higher levels, and it is the balance and that regulation and the ways in which our hormones interact that really guide us throughout these changes and guide us throughout puberty and into periods and into early years of reproduction and fertility. So this might be one of my favorite charts ever because explaining the menstrual cycle is very complex. But I want people to understand that if you understand why the cycle happens, you'll understand when there's issues with it and how medicine works to interact with it or modify it. So if you're starting with a cycle, by virtue of a cycle being a circle, you can't really start at any particular starting point. It's a circle. So we just have to pick a starting point. So when your period has just ended, the estrogen level is super low. The lining of the uterus is super thin because it just shed. The brain releases a hormone that actually stimulates the ovary to release estrogen. Estrogen works to thicken that lining. In the middle of that cycle, there's another hormone release that causes ovulation, which is kind of this guy slapping this follicle to release an egg. Ovulation is release of an egg. It's the midpoint of the cycle. So that lining is thickening, that egg is releasing, and then your body literally waits around with progesterone taking over to see if the egg will be fertilized. When that egg is not fertilized, progesterone slowly drops and the period starts. That's it. People sometimes don't even understand what a period is. The period is the uterine lining getting ready for a pregnancy, and the pregnancy not occurring and it's shedding. And it does that in a cyclical fashion. That's it. Some people think that it's a detoxing of your body. It is not. Some people think that it's shedding something terrible or bad. It's not. None of those things. It's just that the uterus is getting thickened to support a pregnancy. An egg is released. That pregnancy does not occur. That egg does not get fertilized. And so that lining has to be cleansed out, has to kind of shed out so that it can start over. That really helps us understand that if we can block ovulation, we can prevent pregnancy. That's what a lot of birth control does. If someone hasn't had a period in a while and I can give them medicine, progesterone for 10 days, and then let that progesterone stop, then I can invoke a period. If someone doesn't have adequate estrogen around, that lining is not going to grow. If someone has too much estrogen, that lining can grow too much. And so those are all of the things that I utilize to understand people's periods, which is why I go by the period doctor. The majority of my care is focused on periods. So I hope that was a helpful slide. So anywho, let's talk about some period facts. So menarche is the very first period that a person has. It typically comes about 2 years after breast development starts, and the average age is 12 and a half years old. So that's important to know. A normal period for our teens and our young adults should last 7 days or less. It typically occurs every 21 to 45 days, and so that averages to about every month. The first 2 to 3 years of starting the period can be irregular. Now, when I say that they can be irregular, it doesn't mean that we let anything go. Absolutely not. If someone's bleeding too much, that's a problem. That can cause things like anemia, and you need to be partnering with the doctor to talk to them if that does occur. So although we know there can be irregularities, it doesn't mean that we don't get adequate medical care when those irregularities occur. And then when it comes to bleeding, it can be managed by so many things. I was talking with Susan about this earlier. There's so many new menstrual products around because people are getting creative about the ways in which they manage their bleeding. So there's special underwear that's designed to be super absorbent and to wick that blood away from the skin. We have pads, we have reusable pads. We have tampons, some that are organic. We have menstrual discs and menstrual cups, which are devices that actually just hold the blood or hold that kind of period tissue, and then you kind of remove it later. So important things about that really are focusing on period hygiene. You know, it's one thing to know, hey, I'm going to have a period. I got to do something about it, but how do you do it? It's important to wash your hands before inserting a tampon or a menstrual cup or a disc. It's important to wash your hands after removing them because you're working with bodily tissues. And then you want to make sure that you're changing these products appropriately. Really, tampons are important to change every 4 to 6 hours is the recommendation because of something called toxic shock syndrome. And we know that the risk increases the longer you leave a tampon in place. So if you exceed 6 to 8 hours, you're really increasing your risk unnecessarily. And so the idea is to change that tampon. Another reason why we say don't sleep in tampons is for that reason. I don't know if you've ever met a teenager, but they can sleep forever. And so they're not going to necessarily have something go off in their head and say, oh, it's been 6 hours. Let me wake up and change my tampon. So we say, you know, at night, really alternate between a tampon and a pad, decreasing changing from a tampon or pad and kind of alternating also decreases risk of that toxic shock syndrome. That's still exceptionally rare. It occurs at 1 in 100,000. So it's not something to be so afraid of that you never use a tampon if you need to, if you're a swimmer, an athlete, or something like that. But you need to know the best way to utilize that product. So abnormal periods, kind of on the flip side, are those that last longer than 7 days. Again, you don't want to bleed so much, that your body can't make up for it, that your body can't replenish those blood stores. And then periods that cause pain that's so severe that you miss school or work. That's not okay. That can damage our, ability to actually excel in school. It damages your ability to participate in sports, and to earn income, earn money. So missing school or work and not being able to do your daily activities is not normal. And then another way to identify an abnormal period is a period that requires change of a pad or a tampon every hour. That's too often. That means that you're bleeding too often. You might be losing blood too rapidly. If your periods make you feel short of breath or lightheaded or dizzy, those are other signs that maybe you're bleeding too much. You're tipping into a state of anemia or you're not adequately hydrated and your body's not able to function at the level that it needs to. It's also abnormal for a period to start in a child before the age of 9 and then after the age of 16. Sometimes there isn't a major issue going on and that child is just going to start, at 8 years and 10 months or 16 years and 1 day, but that's out of the realm of typical. Most people are going to start well within 9 years and 16 years. And so if you're before that or after that, it's appropriate to seek medical care to make sure we're not missing something. And then periods that spontaneously go away for longer than 45 days after starting, that's something that's also abnormal. So how do we address these period concerns? Let's say we've got a period, we know that there's something not quite right. What do we do? So if you're a teen or a child, talk with your parent or guardian so that they can arrange for you to see a qualified healthcare provider. And that really matters. You want to make sure that you're seeing someone who knows what they're doing, who is working in a safe environment, who has, clean facility and sterilized tools and all of those things that are appropriate and necessary to care for you. You can see a number of different providers. You can see your primary care physician, a family doctor, an internal medicine specialist, your pediatrician. They're often the ones who see teens and kids first when it comes to period issues because they've been caring for these kids their whole life. You can also see an adult gynecologist, but of course I am biased, so I feel that seeing a pediatric and adolescent gynecologist may be the best way to go. But I know that's not always possible. There's only 3 fellowship-trained pediatric and adolescent gynecologists in the state of Georgia, which is a big deal. And we actually all trained at the same institution in Texas. I would be the only minority one, the only woman of color in the group of 3 in Georgia. I'm the only Black one in Georgia, actually. Yeah.
And Doctor, I have a comment. I'm always telling people that this is the age of specialization now. The science of medicine has progressed so well that you can specialize. And I tell individuals back when I was coming up, a physician had to know everything. There was no specialization, hardly any specialization. Nowadays, I tell people, when they call, they always call Pop Barnes and said, listen, I know you have a very, very, very good family practitioner, extremely good, but this is the age of specialization. When you have a specific problem, you need to go to that specific expert. And so I'm kind of glad that you have this on your slide because it is the age of specialization now. And if you have a problem with your kidneys, what do? You go to a nephrologist. If you have a problem with your heart, you go to a cardiologist. And so if someone has if a woman has a problem, then she needs to go, especially, and age is important on this here, because Andrea brought up a very good point. When we were coming up with my sisters, we knew nothing from nothing. We didn't know what to do. In fact, I'm going to ask you a question later on because one of the things, I was the only boy among my sisters. When my sisters used to have dysmenorrhea, that they always gave ginger tea or something like that, some of the old-fashioned remedies for that. And I'm glad that you have this slide up here that when there's problems, then you need to go take care of it. Pain is a signal. Pain is a signal that alerts you that you need to see why it's happening.
Absolutely.
And so,
I'm so happy you said that.
And so I'm glad that you said that you covered this, because it's really important to go to a specialist, because it's an age of specialization.
It truly is. And that speaks to, just as you said, the knowledge that we have. We're at a point where you can know a lot about a specific area. And when that area arises, you really can be that best person for it. Now, there's so many people who know a lot about a ton of things, and they're awesome and they're necessary. But when we start to kind of get in areas where, gosh, I've never seen this before, this is getting uncomfortable, this is getting, kind of odd, certainly referring to a specialist is really good. And everyone in this area has done an exceptional job with that. I've had pediatricians say, I started this medicine, I'm comfortable with this medicine, it didn't work, and now we need something else. We need your help. And I love that. Working with them in their, comfort, and they know how to recognize when that comfort is kind of breached. So that's really quite important. So this is my last slide. Can you guys still hear me and everything?
Oh yeah, you come
Sure,
in.
doctor.
Okay, this is my last slide. So when should you start seeing a gynecologist? And so a lot of people ask me this because they're surprised that I see children that are kind of younger, that I have pediatric gynecology. Even when I say it, they say, oh, but when you think about it, for example, a pediatric cardiologist, well, you wouldn't think a child would have a heart attack or something like that, but children have different cardiac issues, oftentimes things that they were born with. They're congenital. They were actually born with them. And then adults may have things that they weren't necessarily born with, but they acquired over time. And so that's why you can have different subspecialties according to age, because your focus, your approach, the etiology, and the treatment is different. And so you can start seeing a gynecologist. The recommendation is between the ages of 13 to 15. But the youngest patient I've seen is probably less than a month old. If there's an issue with the way they were born, with their external genitalia, all of those things, I've been trained to evaluate all of that. Surgery on a young child, I've been trained to evaluate that, doing minimally invasive approaches. And so while the recommendation is between 13 to 15 to just be established and talk about your periods, if there's a concern that's related to the reproductive process, being a female, you can see a pediatric gynecologist as soon as you need. Also, you do not have to be sexually active to see a gynecologist. That's one of those old school myths that just is not true.
Doctor, I'm so glad that you have that on your slide. I am so glad that you have that on your slide to emphasize that, because that's extremely important.
Yes, it's a barrier. A lot of people are afraid that if they have an appointment with a gynecologist, someone may think, oh no, they may think that she's sexually active. No, she's seeing a doctor that she needs to see, just like you see any other doctor. Someone making an assumption about your need to see that doctor speaks to their ignorance, and them not honoring someone's, personal life and their privacy. But you never need to delay seeing a specialist just because of what other people may think. That's completely inappropriate, and it's just completely, it's wrapped up in a lot of patriarchal, teaching and myths and shame. And that's just, I don't like that, because a lot of girls who may be suffering in silence will delay me because of that fear, and that's inappropriate. For the visit, we may do an exam. We may need to collect some blood tests to check out those hormones. Sometimes we need to do imaging studies to look at the uterus, the uterine structure, to see if we need to do surgery. I need to plan my surgery to see what needs to be removed. And so we do need imaging studies there. And then while some period issues can resolve on their own, some may require medications and procedures. Sometimes we're making diagnoses that can be chronic or lifelong. And then one important point that I just love to reemphasize, things change. They've changed over the last 10 years. But one of the things that has changed significantly is that requirement for pap smear and cervical cancer screening. We actually don't do that anymore until age 21. That is regardless of sexual activity. So I want everyone in the world to know that, because I have moms bringing daughters in at 16 and says, she needs a pap smear. I'm like, oh, actually, that, 15 years ago, that was true. But now we wait until age 21 because we know so much more about the way cervical cancer occurs, about the HPV virus and its interaction with causing cervical cancer. And we can safely say that a pap smear at age 21 is appropriate regardless of sexual activity. So that's the last of my slides. I'll open it up for questions. Here's just kind of some contact information for me when it comes to my speaking engagements and education and just social media and social platform. The Period Doctor on Instagram, my email info@theperiodoctor.com, and my website, theperiodoctor.com.
And Dr. Chambers, I like that title. And I tell everybody I'm the hardest working elected official. No, let me tell you why I like that. Because when I went on Facebook, even before I friended you, I saw this. I said, the period doctor. I said, boy, that's really letting everybody know it's okay to talk about it. I am the period doctor. I'm the period doctor. If we got problems.
I chose that name for that reason. You have to say period. People don't, they'll say time of the month, they'll say that thing, they'll say every word but period. Not a bad word. If it didn't occur to our daughters, we'd be alarmed. So it's normal. It's okay.
But you put it out front too, because let me tell you, I think of all the things about this here, and I told you I was the only boy, so I was the one my grandmother sent to the pharmacy to get that brown paper bag with that box in it. You understand? My grandmother said, bring it right to the house. Don't talk to nobody. Bring it right on. And then, this is the thing. When I put the box in the house, the box disappeared. I never saw the box again until my grandma said, we go out to the pharmacist. And so that is the kind of mentality, unfortunately, still a lot of people have. So when you put it out there on the table, I'm the period doctor. There's no discussion. There's no cloak. There's no hidden doors. No curtains that nobody can peek through. And all this here. Look at Andrea. You said I'm the period doctor. Let's get the conversation on. And so something like that is good, because even now, because we got 12 grandchildren and 7 great grands, majority females, and since I've been out, it's disturbing how so many people we want to whisper this here. We don't want to whisper. Well, this is important because it deals with your body. It deals with your body. And so let me just tell you, I've already asked my questions. So Andrea and Susan, I've asked my 3 questions. And so and I've got one more. Because I'm from the old school. I told you I have girls, and the new ruling that you don't have to get a PAP until 21. Is that correct?
Yes.
That is, I'm going to be honest with you, I think that is welcome news.
Yes.
I think that is welcome news. I really think that is welcome news. And so, boy, I'm telling you, hey, I want to tell you, Andrea, you were right. You were right. To get Dr. Chambers on here, I see why you were doing somersaults and knocked me aside the head. As my uncle used to say, hit that boy aside the head. Hit me aside the head.
I told you, Pops. I said he said we're gonna talk about what? I said we're gonna talk about periods.
And guess what? And I said, yeah, look, well, we need to do this here. And
that's right.
And so you guys, we still got time, y'all. We got 5 minutes because it's 10:20.
Yeah, well, let me.
Go ahead.
Yeah, one of the things that I wanted to really emphasize that Dr. Chambers was talking about was that this is a quality of life issue for our young females, and that when you're dealing with this once a month, that you have 7 days out of every month, that you have to be able to manage that, and it's our job to help them. And if they're having problems, young girls are suffering in silence and struggling, and they don't have to. Like Dr. Chambers was saying, that there are procedures or medication that they can have, that they don't have to deal in debilitating pain and miss school or miss work. And so now, we're blessed to have Dr. Chambers here. We've got a gym here in Columbus, Georgia, that they don't have at other places.
Right.
And so, mothers and dads need to, talk, have conversations with your daughters about this. And if there are problems, then, make an appointment with Dr. Chambers, or start with your pediatrician and let her or him reach out to Dr. Chambers. But I think just by us having Dr. Chambers here, opens the door for the conversation that, like you said, Pops, that once you brought that box in, you didn't see it anymore. So this is a big deal. It's relevant to all of our women, especially our younger women. Now, I do have one question. I'm going to show my ignorance here because I saw something on one of your slides. I did not know what it is. And that you called it a period disc. And I don't know what that is.
I actually have one. Let me grab it so I can show you.
Oh, do you know, Susan?
I know what the cup is, but not the disc.
Okay.
People send me a number.
Pops, do you know what the cup is?
I don't know what the cup or the disc is. I want to be honest with you. That's why I'm waiting to see.
The disc is kind of like a cup, right? It's just basically you can either absorb blood or you can capture it, right? And so this is inserted and the blood can just hang out in this. It's softer. It's very flexible. So you can just kind of bend it and make it as small.
See. Okay, good. It's flexible.
Yep. And then the collection is just here. And then you take it out and kind of dump it out. A cup is very similar, but it's just shaped a little bit more kind of long, like a tulip. So this is a little flatter. And for some people it's more comfortable. The cup sometimes captures and holds a little bit more than the disc.
Would you clean and reuse the disc?
So the disc, you don't reuse it. The cup, you do reuse.
Okay. Yes. Okay.
So the disc is one time, but the cup is reusable.
Exactly.
Is
the
a cup?
disc can be worn for 12 hours.
Say that again.
The disc can be worn for 12 hours.
So that's a good for overnight.
That answers my question because I was going to ask you what were the benefits with a disc and a cup.
Exactly. So the disc, there's not that organic kind of cotton. You're not changing as many times, and it can hold as much as maybe 2 to 3 tampons. The cup is also yeah. And so there was a story. I forget what the story actually is. It's a book written by a woman who was going hiking. But of course, she was going to have her period. She was hiking for 3 months, and she used a menstrual cup because instead of packing all of those things, she just had one cup that you're able to clean and just insert and use. It's great for the environment. You know, it's something that you know you have the protection you need. You don't have to run to a store. All of those things, that's very helpful.
Well, Doctor, I'm going to be honest with you now. That is a conversation. Every time I have people come on and they talk, I always tell them you need to come back because in what you presented, there were a lot of other little vignettes that you could actually speak about. And what you were talking about, because a lot of women, they do feel at that time, for a number of reasons, they can't do this or they can't do that and whatever. And that's restrictive of their activity. And I know a period is not supposed to be restrictive of activities like that. I know through my daughters. And so that would be something that, because you see, Andrea didn't know about it. Obviously I didn't, that you could really talk about more that would make things, that would educate the community so that they will know that these are things they can use. Here's something that my grandmother used to always say from various times with my sisters. I didn't know until my sister mentioned to me and said, "You're walking too hard because my cramps are killing me." Which is the biggest thing during that time. And back then there was we had old-fashioned remedies. I know my grandmother used to do the ginger tea and there was something else. Oh, really? But I keep telling everybody my grandmother's the smartest person I ever knew. My grandmother was smart, and she used to give my sisters the ginger tea to drink. And I knew that when they would drink the ginger tea and they lay down a while, that they would come around. So even for some of my daughters that were having difficulties prior to their period, is there anything that they can do that would ease the cramps or whatever?
Right. So the cramping of the period has a lot to do with inflammation. So the uterine lining, it really is just like a triangle-shaped lining. It releases inflammatory markers before your period starts to start those contractions and to start that bleeding. And so anti-inflammatory medicines work well. That's why ginger tea works well. Ginger has anti-inflammatory properties and anti-nausea properties. So some people also have nausea during their periods because of kind of the flux of hormones. So ginger works quite well. Other medications just kind of over the counter would be anti-inflammatories like Aleve, ibuprofen, Motrin, Advil. All of those things are anti-inflammatories and work well for period cramps.
And that's what I used to tell my daughters to get, and that was a lot easier. And you know, to be perfectly honest with you, it's so cathartic to be able to have a conversation like this. And let me tell you, I'll give you all the props in the world for putting it out there. No, yes, I'm bona fide, qualified, and any other kind of fide you want. Because go ahead on, doctor, because I'm the period doctor. And doctor, I have a TV show called Focus on Health.
Mm-hmm.
And it's from CCG TV. It runs twice a day for 3 weeks. Awesome education. And I would like to invite you to come on, let you look at your calendar. We do it on the 3rd Tuesday of every month at 10 a.m. It's a half an hour program.
Okay.
And it's we put it on YouTube and all this other kind of stuff to educate people. It has been a joy, doctor. Now, what I would like for you to do, I would like for you to tell twice the brick and mortar location and your contact information. You have two locations, so you have to get both locations and both numbers, because I am telling everyone, female, you need to go. Dr. Chambers, she's off the chain, good with all this knowledge. She's down. She's really regular folks, and she is the period doctor. And she is a specialist that will, any of your gynecological needs, she and her father and her brother, so you know they're smart now. You're talking generally, you're talking, so they know what they're doing now. So, doctor, give your brick and mortar, all the locations, brick and mortar, because we still got time, and the phone numbers that they can call to get appointments.
Okay, so for girls that are 19 and under, I see them at my location, which is 705 17th Street. And the phone number for that is 706-494-4387.
All righty.
My dad's practice, Chambers OBGYN, that would be where I would see girls that are 20 and 21, maybe who would be interested in getting their first pap smear, just so, because I want them to have a good experience. I want to be able to talk with them about why we're doing it and their opportunities moving forward. And that's at 811 22nd Street in Columbus, Georgia. The number there is 706-323-1054.
Well, let me tell you, for all of my great granddaughters, you can bet your bottom dollar there's only one place where I'm going to be letting them go. And I will tell my daughters who are older that, and I know one that really, I got one other question to ask. I have a couple of daughters, and they were, in the past, they were always talking about their biological clock. Dad, I haven't found the right one, but I want to have a child, and my biological clock is ticking, and dad. And so I would just sit there with my clientele and pat them on the back. There are so many options now, which is one of the reasons I'm going to try to have you come back. You ain't going to get away, doctor. You ain't getting away. You ain't getting away. You've been endorsed by Andrea, by Susan, by me, and let me tell you something. So you ain't getting away. You're gonna bring some of this good education back. When someone's in that situation, what's the options for them to do? What can a woman do?
So many great options, and we never want to rush to have a child before you're ready or before you find the appropriate partner. And so we definitely don't want to use those as limiting factors. Really, one of the things that we're doing more commonly is egg freezing. And that sounds kind of wild, but what we need to know is that as young women, when you're female, you are born with all the eggs that you're ever going to have. Men make new sperm. Women, we don't make new eggs. We have all the eggs we're ever going to have. And so they slowly kind of drop down in number throughout our lives. And so as we start to get into our early 30s, that number drops significantly. And so what that looks like is around your early 30s, you can do a process called egg freezing, where you can go see a specialized fertility doctor who will actually remove the eggs from your body and freeze them in a process that keeps them 30 forever. You got them drawn when you were 30, you got 54 eggs for 10 years. If you were 25, you always got 25-year-old eggs, okay? And that protects them from some of the attrition processes that change those eggs and increase risk of things like chromosomal abnormalities and miscarriages. And so it's a very protective process. And so you don't have to rush to find the appropriate partner. You don't have to rush through your career or any of those things for fear of a biological clock, because you got those eggs right there where they need to be.
See?
Now, a frozen,
Wow.
yeah, it's a real big deal. A frozen egg doesn't mean a pregnancy, because that egg has to be thawed and then form with the sperm to make an embryo and then reinsert and then carry it to term. You know, pregnancy and bringing forth life is an amazing miracle that everything has to go right, but it's a good thing to do if you're worried about that biological clock part.
Right, and
Wow.
you said about the age of 30-ish, or how about,
Yes.
now I know one of my children were born, the mother was 41. She is the last of the Barnes line, and that was 40, but an ideal time to do it is around in the 30s or latter part of the 30s or what?
So ideally before the age of 35, and that's just because research shows that the risk of chromosomal changes in the eggs increases at the age of 35. Now, your eggs don't know when your 35th birthday is. And so if you're 35 in 2 days, it's fine, you know, but
Okay.
ideally before
I
the
got
age
you.
of 35, yes.
I got you. Boy, I'm telling you, doctor, you're right.
That's great.
Andrea, we had to have her
Pops,
on
you can
speed
tell
dial.
those daughters. Pops, you can tell those daughters they don't have to worry about having babies with those old eggs. So now you got the information on what they can do in terms of freezing. So that's good. That's news to me.
And let me tell you something, because I'm going to be honest with you. Now, it's not only my daughters, it's my daughter's friends.
Yeah.
Back in the day when I was coming up, men, I don't know, I don't think men were even more plentiful, but maybe men were more, but there's a desert of these men out here for these girls, these professional women. I mean, they said, well, Mr. Barnes, we just can't find Mr. Right. I said, wait a minute, I need to do an advertisement for y'all, because when they come over,
Pops,
to the
don't
house,
get me started talking about that now.
I know.
They're right.
See that?
In all ages.
See?
All
That's
ages.
where my expertise ends. I'm not an expert on that.
Me neither. But I know it's a desert. So look, I know it's a desert.
Yeah.
And so, doctor,
Don't get me talking about that. That's a whole nother show.
hey, look, when they come over to the house, that's the topic of conversation. After how's doing, they go off into that. And I exit stage left. I know what they're talking. I just leave the conversation completely. Doctor, it has been a joy having you on the program, and you please don't be a stranger. You have a carte blanche to come on, and I want you to think about a Tuesday, any Tuesday of the month, the third Tuesday at 10 a.m. for my Focus on Health show. You can do the same presentation. You are just off the chain great, and I appreciate you. And I didn't mind getting hit across the head, Andrea, a couple of times. You and Susan holding me down, and you hit me aside the head. I don't mind it now, because it was worth it. See, Dr. Chambers. And to our viewing audience, any last minutes, Andrea, any last minute comments on this?
No. Just thank you, Dr. Chambers.
Yes,
It's
thank
been a joy as always, and we appreciate you sharing your God-given wisdom to help improve the quality of life of our daughters. So consider yourself a part of the family.
Yes.
And partners with Pops and his ministry and New Horizons Behavioral Health. So anything that we can do to help you in your passion and your ministry, please don't hesitate to reach out.
Thank you. Thank you.
Susan?
Mhm.
Susan, you have a comment?
I just wanted to share again. I reiterate what Miss Winston said. Thank you so much. And let everybody know I'm wearing green today in recognition of Mental Health Awareness Month.
That's
May
right.
is
Yeah.
Mental Health Awareness. And, one of the things that we talk about women around mental health and having their periods and how it can change your emotions also. So we need to
Yes.
be a little bit of understanding around that and realize that
Yeah.
hormones can impact our mood, et cetera, too. So thank you, Dr. Chambers.
Yes.
And I always say,
And it's not to be used as a stick against us. So,
Exactly.
yes.
you're right,
Yes.
you're right. As I
We're going to
always
use
say-
that stick on you, Pop.
Oh, yeah. You use it already to get Dr. Chambers here, but that's okay, because I'm glad you did. To our viewing audience, as I always say, until next time, always be good and kind to yourself because God loves you. God bless you now. Bye-bye.
Bye.
Bye, everybody.
Thank you. Bye-bye. Thank you.
And end.